Nursing care of patients with integumentary disorders. Psoriasis is itchy skin is an uncomfortable, irritating sensation that makes you want to scratch. But psoriasis can have hundreds of possible causes. It may be the result of a rash or another condition such as psoriasis or dermatitis. Psoriasis may be a symptom of an internal disease such as liver disease or kidney failure. Certain systemic diseases have long been known to cause pruritus that ranges in intensity from a mild annoyance to an intractable, disabling condition. Generalized pruritus may be classified into the following categories on the basis of underlying causative disease: renal pruritus, cholestatic pruritus, hematologic pruritus, endocrine pruritus, pruritus related to malignancy, and idiopathic generalized pruritus. Xerosis is a medical term for dry skin. When it results in skin that is scaly and itchy, the condition is called pruritus. This occurs when natural moisture is drawn out of the skin. The skin needs moisture to protect itself. The best way to relieve dry skin is to use a moisturizer. Too much water can cause the skin to dry out. Habitually showering or bathing more than once a day should be avoided to prevent dry skin. Eczema is dry skin that develops into red, itchy, or painful patches that become cracked or fissured. The skin protects the body against infection, and if the outer layer of skin, the epidermis, becomes cracked or broken, the chance of infection, including cellulitis, which is inflammation of the subcutaneous tissue, increases. This condition must be treated immediately by a physician. Environmental factors such as excessive sun exposure and pollutants in the air can damage the skin. Dry skin is often a problem in cooler climates, especially during winter months when home heating systems are used regularly. This unhumidified heat is dry and draws moisture from the skin. Outdoors, cold winter air causes the body to protect itself by drawing blood away from the skin. When this occurs, the skin is not well nourished and xerosis can result. Benign skin lesions. A cyst is a sac that may be filled with air, fluid, or other material. A cyst can form in any part of the body, including bones, organs, and soft tissues. Most cysts are non-cancerous, benign. It's important to note, however, that nearly all cancers can produce cysts. Tumor. A tumor is an abnormal mass of tissue. Like a cyst, a tumor can form in any part of the body. A tumor can be benign or cancerous. Keloids are the excess growth of scar tissue at the site of a healed skin injury. Nevus is a benign overgrowth of skin pigment forming cells called melanocytes. Melanin, the skin pigment, and the site cell on the skin surface, present at birth or apparent early in life. A nevus can be a birthmark, a benign pigmented spot on the skin such as a mole or a cluster of melanocytes and supportive tissue that appears as a tan, brown, or flesh-colored spot on the skin. A benign blood vessel tumor on the skin, such as a vascular nevus, a local collection of capillaries of the skin, like a strawberry birthmark, stork mark, or port wine stain. Angioma is a benign tumor that consists of small blood vessels. These tumors can be located anywhere on the body. Some of the different types include spider angiomas, cherry angiomas, and senile angiomas. Skin tags. Cutaneous tags are very common skin growth. They usually occur after midlife and are usually harmless and non-cancerous. The tags stick out of the skin and may have a short, narrow stalk connecting it to the surface of the skin. Cutaneous tags are usually painless and do not grow or change. However, they may be irritated by being rubbed by clothing or other materials. Cutaneous skin tags are more common in people who are overweight or have diabetes. They are thought to occur from skin rubbing against skin, so they commonly form in skin folds. Seborrheic keratosis are common skin growths. They are benign growths that occur almost anywhere on the skin. Some people get just one, others develop many. Having seborrheic keratosis is more common, usually beginning as small, rough bumps and tend to eventually thicken and develop a warty surface. Psoriasis is a common skin disease that affects the life cycle of skin cells. Psoriasis causes cells to build up rapidly on the surface of the skin, forming thick silvery scales and itchy, dry red patches that are sometimes painful. Psoriasis is a persistent, long-lasting chronic disease. The patient may have periods when the psoriasis symptoms improve or go into remission, alternating with times the psoriasis worsens. For some people, psoriasis is just a nuisance. For others, it's disabling, especially when associated with arthritis. No cure exists, but psoriasis treatments may offer significant relief. Lifestyle measures such as using a non-prescription cortisone cream and exposing the skin to small amounts of natural light can improve the psoriasis symptoms. Psoriasis can occur on any part of the body and is associated with other serious health conditions such as diabetes, heart disease, and depression. Folliculitis. The infection usually appears as small white-headed pimples around one or more hair follicles, the tiny pockets from which each hair grows. Most cases of folliculitis are superficial, and they may itch, but on occasion they're painful too. Superficial folliculitis often clears by itself in a few days, but deep or recurrent folliculitis may need medical treatment. Furnicles. Boils usually start as red, tender lumps. The lumps fill quickly with pus, growing larger and more painful until they rupture and drain. Carbuncle. A carbuncle is a cluster of boils that form a connected area of infection under the skin. Cellulitis is a common, potentially serious bacterial skin infection. Cellulitis appears as a swollen, red area of skin that feels hot and tender and may spread rapidly. Skin on lower legs is most commonly affected, though cellulitis may occur anywhere on the body or face. Cellulitis may affect only the skin surface, or cellulitis may also affect tissues underlying the skin and can spread to the lymph nodes and bloodstream. Left untreated, the spreading infection may rapidly turn life-threatening. Erysipelas is a superficial bacterial skin infection that characteristically extends into the cutaneous lymphatics. Erysipelas has been traced back to Middle Ages, where it's referred to St. Anthony's fire, named after an Egyptian healer who was known for successfully treating the infection. Fungal infections. Candidiasis. Candida is a common infection in people who have weakened immune systems, as well as a common hospital-acquired nosocomial infection. The fungi grow in damaged skin and can spread through the bloodstream to cause infection throughout the body. Candida lives on the body without normally causing disease, but it can cause infection when it enters the bloodstream through the digestive tract. It can also be transmitted through contaminated medical equipment. Tinea pedis is a term used for a dermatified infection of the soles of the feet and the interdigital spaces. Tinea capitis, or ringworm on the scalp, is a common fungal infection in children. The main way it's transmitted is by coming in contact with the affected person or animal. Tinea corporis. This is a superficial dermatified infection characterized by either inflammatory or non-inflammatory lesions on the skin regions except the scalp, groin, palms, and soles. Tinea versicolor is a common benign superficial cutaneous fungal infection usually characterized by hypopigmented or hyperpigmented macules and patches on the chest and back. In patients with a predisposition, tinea versicolor may chronically reoccur. The fungal infection is localized to the stratum corneum. Pediculosis is an infection of the hairy parts of the body or clothing with eggs, larvae, or adults of lice. The crawling stages of these insects feed on human blood, which can result in severe itching. Head lice are usually located on the scalp, crab lice in the pubic area, and body lice along seams of clothing. Body lice travel to the skin to feed and return back to the clothing. Scabies is a common skin infection that causes small itchy bumps and blisters due to tiny mites that burrow into the top layer of human skin to lay their eggs. The burrows sometimes appear as a short, wavy, reddish, or darkened lines on the skin surface, especially around the wrists and between the fingers. A child who has contracted scabies can also develop a bumpy red rash. Scabies is contagious and is usually transmitted by skin-to-skin contact or through sexual contact with someone else who is infected with it. The infection spreads more easily in crowded conditions and in situations where there is a lot of close contact, like child care centers or nursing homes. Varicose, the warts are tiny skin infections caused by viruses of the human papillovirus. Although children get warts most often, teens and adults can get them too. Sometimes warts are sexually transmitted and appear in the genital area, but most warts affect the fingers, hands, and feet. Some people appear to be more susceptible to warts than others. In fact, some people never get them. This may be that some people's immune system make them less likely to get the virus that causes warts. The virus can cause warts or pass from person to person by close physical contact. Having a tiny scratch or cut can make a person more vulnerable to getting warts. Herpes simplex. Cold sores, which are small and somewhat painful blisters that usually show up on a person's lip or are caused by the herpes simplex virus. But they just don't show up on the lips. They can sometimes be inside the mouth, on the face, or even inside or in the nose. These places are the most common, but sores can appear anywhere in the body, including the genital area. Genital warts isn't typically caused by herpes simplex virus 1. It's caused by another type of herpes simplex virus called herpes simplex virus 2 and is spread by sexual contact. But even though herpes simplex virus 1 typically causes sores around the mouth and herpes simplex virus 2 causes genital sores, these viruses can cause sores in either place. Herpes zoster. Herpes zoster is a painful burning rash that has open fluid-filled blisters. Shingles is caused by the varicella zoster virus, the same virus that causes chickenpox. After you've had chickenpox, the virus lies inactive in nerve tissue near the spinal cord and brain. Years later, the virus may reactivate as shingles. Contact dermatitis. Successful contact dermatitis treatment consists primarily of identifying what's causing the inflammation, then avoiding the offending agent. The rash usually resolves in 2 to 4 weeks. Self-care measures such as wet compresses, anti-itch creams can help soothe the skin and reduce inflammation. Atopic dermatitis. Eczema can affect any area, but it classically appears on the arms and behind the knees. It tends to flare periodically and then subside. The cause of atopic dermatitis or eczema is unknown, but it may result from a malfunction in the body's immune system. Self-care measures such as avoiding soaps or other irritants and applying creams or ointments may relieve the itching. Seborrheic dermatitis. Seborrheic dermatitis isn't harmful, but it can be uncomfortable and unsightly. Seborrheic dermatitis predominantly affects the scalp, but it can occur between folds of skin and on skin rich in oil glands. It can occur in and between the eyebrows, on the sides of the nose, and behind the ears, over the breastbone, in the groin area, and sometimes in the armpits. Exfoliative dermatitis is widespread scaling of the skin, often with pruritus, erythroderma, which is skin redness, and hair loss. It may occur in severe cases of many common skin conditions, such as eczema and psoriasis. It is sometimes caused by an allergy to drugs. Acne, comedones, whiteheads, and blackheads are created when the openings of hair follicles become clogged and blocked with oil secretions, dead skin cells, and sometimes bacteria. When comedones are open in the skin surface, they're called blackheads because of the dark appearance of the plugs in the hair follicles. When the comedones are closed, they are called whiteheads, slightly raised skin-colored bumps. Papules are small raised bumps that signal inflammation or infection in the hair follicles. Papules may be red and tender. Pustules are red, tender bumps with white pus at their tips. Nodules are large, solid, painful lumps beneath the surface of the skin. They're formed by the buildup of secretions deep within hair follicles. Cysts are painful, pus-like bumps beneath the surface of the skin. These boil-like infections can cause scars. Acne vulgaris. Hormone changes that cause an excess of oil in the skin are leading cause of acne vulgaris, and this condition is commonly seen in puberty. In puberty, breakouts are a response to the levels of hormone testosterone that is found in both males and females in varying degrees. Women do secrete small amounts of testosterone at different points in their cycle, and these types of lesions are common in women even after puberty in the days leading up to their menstrual period. As hormones changes become more stable over time, the acne vulgaris lesions will begin to diminish or decrease and will eventually disappear. The amount of time that it takes for acne vulgaris to disappear entirely is different for every person, but it commonly disappears by the end of the teenage years. Acne rosacea. This is a chronic inflammatory skin condition that affects adults. It causes redness in the face and produces small, red, pus-filled bumps or pustules. Left untreated, rosacea tends to be progressive, which means it gets worse over time. However, in most people, rosacea is cyclic. This means that rosacea's signs and symptoms may flare up for a period of weeks to months and then lessen for a while before flaring up again. Besides acne, rosacea can be mistaken for other skin problems, such as skin allergy or eczema.